person, but we're doing what we can. So this is Be Strong Families webinar series, staying strong and positive for ourselves and our children. And we have been going strong on this webinar series since March 23rd. And some of you have been with us since then, like Tammy. Hi, Tammy from Pennsylvania. We'd love to ask you to open the chat while we're waiting to get started. And if you can go to the drop-down menu and choose the second one down that says all panelists and attendees. So some of you have done that and some of you haven't. So if you can choose all panelists and attendees, that is going to serve us well for the kind of conversation we're going to have going forward. So I just want to give a welcome to Ruth, who says, hi, Sarita, and also to Emily Hauser. Hi, Emily from Waynesburg, Pennsylvania. And Yolanda's here. Yolanda needs to switch to all panelists and attendees, but Yolanda's here from Reading. And Ruth says she's here from the Center for Sustainability in Molina, Colorado. That's awesome. Ruth, are you also on our sustainability webinars? And welcome Rebecca Barton from Washington. Is that Washington State, Rebecca? Elda, welcome back. Elda's somebody who comes all the time. And Cynthia. Hi, Cynthia from Las Cruces, and Gabriel from Las Cruces. And Rebecca, yes, Washington State. Awesome. Well, we're going to get started exactly on time at 12 o'clock. And I'm very, very excited about this conversation that we're going to have. How will COVID end is our question. And we're here today, Sarita and I are co-hosting, and we're here today with Lisa Goetz-Spitko, who is a nurse practitioner and Master's of Science in Nursing, and has been providing women's health care since 1991. And she also happens to be my sister. So my real bona fide biological, we grew up together sister. So I'm delighted to have Lisa here with us. She answers a lot of questions about the vaccine for a lot of patients, and she does primary women's health care in both the hospital and office setting. So welcome to Lisa. And Sarita, it's always a pleasure to be here with you. And I want to also acknowledge Andrew, who's in the background and is going a bit more. But Andrew, we're grateful to. He's running the text.
Glad to be here.
So as people are coming in, we have more than 80 people registered for today, but it takes a little while for everybody to get here. I want to remind those of you who are regulars and also those of you who haven't been before that these are our ways to engage. We don't have the luxury of seeing you or being able to, to see you, or these are our ways to engage. So the first one is the chat. And that's why I was like emphasizing, make it to all panelists and attendees, because that's really the primary way in these webinars that we communicate with each other. And the chat is yours. You're free to put a question in at any point. We may not answer it right when you put it in, but we will get to it. You can put a question in, you can put a concern in, you can talk to each other, respond to what somebody else's comments. The chat is yours. And we love a robust chat. The second way is if you have more to say than will fit in the chat, you can raise your hand and then Andrew will unmute you. You'll unmute yourself and you'll be able to speak. So those are the two ways to engage. We also, Be Strong Families recognizes that we co-create this safe space, and the way we co-create the safe space so that everybody can be relaxed and feel like they can learn and they can be vulnerable and they don't have to say it exactly right all the time, is that we have agreements. So our agreements for today are speak from your own experience, use I statements, treat others the way you want to be treated, be here with us now. And the last one is if you need a minute, take a minute. And we usually do that when we think a topic may be challenging or triggering. If you need to step away, feel free and come back. And if you agree to these agreements, please do like our like Tracy and Kelsey. Panya, you need to direct it to all panelists and attendees. Yesenia, same thing. Check that, please. Everybody check once and for all that you're sending your comments to everybody. Hilda, thank you. Ryan, thank you. Sarita agrees. Awesome. So let's get started. The topic for today was, how will COVID end? And I thought there were two questions that came up at the same time. Right. So the two questions we have here are, what will we be able to do post-COVID that we can't do now? And what needs to happen for COVID to be over? So I'm not saying what to return to normal, but I'm saying, like, for us to feel like COVID isn't a thing, for COVID to reduce to the point where it's like any other disease that people get. What will happen when that ends? Looking to the future, what will we be able to do post-COVID that we can't do now? And you can either raise your hand or put it in the chat. What are you looking forward to doing after COVID isn't a thing anymore? When I created this slide, I put the two hugging people because they look like they could be friends. They look like, on the street when you meet somebody that you haven't seen for a while or who just is a good friend, you could hug them, or you can, put your arms around them.
I had all these thoughts going around in my head, Katthe, and didn't even clue into the picture because, oh my gosh, I have so many people that I want to hug. Like, I'm a hugger. I miss hugging people.
Spend time with relatives, Elda says. Yep, seeing people's smiles, Lisa says. Emily says, family time outside of the home with my child and husband. And Panya says, be with my family from out of state. And Tammy's definitely looking forward to hugging people. Cookout with friends and family, right? Andrew, go to a concert. Yeah. Traveling out of state to be with family again, Tammy says. Siobhan says, going to the movies or really anywhere without worrying. Yeah, and I think for me also, I think I've been in this, I said I was like getting a touch of agoraphobia, like I just don't go out. It's not worth it. And it's not like I'm concentrating on not going out. It's just like I've gotten myself very comfortable having food delivered and staying in my apartment for days. And I never used to stay in my apartment for days. So traveling is one thing. I used to travel all the time. Yeah, there's traveling freely without feeling unsafe. I'd love not to wear masks anymore, Tammy says. Yeah, in-person interaction, Ruth says. Renee says, doing community things. Rebecca, no masks? Yes to all of this, Sarita, right?
Yes, I can't wait. I just can't wait. I feel like a kid. Like, when am I going to get out of this house? I don't know. I just said that to my physical therapist this morning. We're going away this weekend and we're only going to a hotel. But I'm like, we're going to a hotel and then we're going to go to dinner. And I'm so used to traveling, and being stuck in the house for like a year is like, I got to get out of here. I feel like a kid. I'm losing my ish.
Alexandra says definitely traveling. So we do have these things that we're looking forward to when COVID is over. What is your understanding of what needs to happen for COVID to be over? Like, meaning for COVID to be not a thing, like for COVID to be like the flu. It's still around. Rebecca says herd immunity. What does herd immunity mean? Rebecca, could we unmute you and tell us what, but Renee says vaccinations, like a number of people being vaccinated. But what is herd immunity? I've heard that term before, but I just wonder, does anybody, high enough percentage of, Kelsey says, for a high enough percentage of us to be vaccinated that outbreaks no longer occur, because it's never going away. Yeah, and evidently it's always been around. Like coronavirus has always been around, right, Lisa? Is that
correct?
Accurate? Yeah. So
Yeah,
it means
so
people have
that,
been vaccinated or have had the disease, so they won't get it or spread it.
right. So that means if all of my friends and people around me get the vaccine, then I don't have to get the vaccine. That's herd immunity. Like a whole bunch of people get it, I don't get it. So then, I don't get the vaccine, but everybody around me gets the vaccine. So then I'm pretty much good. That's like layman's terms of herd
Your
immunity.
understanding of herd immunity, Lisa?
Huh?
I'm asking Lisa too, what her understanding of herd immunity is.
I guess, Sarita, that makes me nervous when you say you can wait for everybody around you to get vaccinated and then you don't have to, but we won't go down that road right now. But it is, as somebody put in the chat, at least 80% of the people being vaccinated and having immunity to it in some way or another, so that we don't pass it just by coming in contact with people.
So it'll become less difficult to get too. Is that true? Like,
Well,
we don't pass it. We don't pass it. Like,
well, if less people that have it, less people that are carrying the virus and shedding it, the ones that are symptomatic, it's actually easier to know and stay away from and protect from. It's the asymptomatic ones as well, that are the ones that are the biggest spreaders, who will go out and do whatever, and you don't know that they're,
mm-hmm. So Rebecca says it protects people who can't get the vaccine, same as with measles, etc. So if enough people, can't get it, then that kind of does, protect other people. Okay.
absolutely.
So we have some kind of understanding of what needs to happen for COVID to be over. Is there another question here? Oh, yeah. When do you think that's going to happen? Or what is your understanding of when that's going to happen? When, because that's one of how will COVID end? Rebecca says hoping for September. Renee says unsure. I remember when it started, we thought, oh, it'll just be at the end of the summer. It'll be September. And no, maybe it'll last to January. And now we're back to maybe 2022, maybe January 2022. Renee says, I thought a couple of weeks at the beginning. Yeah, right. Ruth says, I'm hoping for a second semester to start getting activities back to semi-normal at least. Elda's not sure when it's going to happen. Tammy says, I know people who keep saying they're hoping for June or October, but I think I'll be glad if it's done by this time next year. Awesome. Okay. Well, as most of you, if vaccinations continue, Lisa says fall to winter, if vaccinations continue. Lisa, you can talk. You don't have to put it in the chat.
That's all right. I prefer chatting it.
But nobody can see it because you're only sending it to me and Sarita. Okay. So fall to winter, that would be cool. Like, great if next year we could have Thanksgiving. I mean, this year it would be great if this year.
Okay.
We could have Thanksgiving.
Okay. You made me nervous. I'm like, I'm not staying in the house. I am going to stay in the house. I'm not going to stay in the house. I don't know what I'm going to do. I'm tired of being indoors. And now it's winter time, so I'm really feel
cabin crazy. Okay, let's go to the next slide.
Good for travel.
As people were talking about, the vaccine is pretty important in order to be able to achieve herd immunity, or to be able to get to the point where we are not, where COVID's not a thing as much, like where it's around and you get COVID or whatever, but it's not gonna kill you. So we have a poll now that we want to ask people how you're feeling about getting the vaccine. And please be honest, because there's no wrong answer. I mean, I know that there's a lot of judgment around this, but it's we want this to be kind of a judgment-free zone. And we want to honor that you are where you are and that you have good reasons for being where you are. So please answer honestly. And then Andrew, are you going to put your face back on so we can see you? And then the four of us are going to be answering while you're answering. And then when we're done answering, we'll show you what the results of the poll are. So who would like to start on our little panel of four here?
I'll start. I've been vaccinated with both, with the Pfizer vaccine. I've probably had both doses for about a month now.
Okay. And are you happy? Why did you do that?
I'm extremely happy. Well, I work in a hospital and outpatient with patients all the time. And beginning of the COVID outbreak, we thought we were walking into our death sentence every time you'd walk in, and you'd come home and strip before you even hit the door. You'd take your clothes off, throw them right in the washer, and get in the shower. I mean, it was a truly regimented routine of when you'd come in from the hospital or the outpatient area. And not that we still wear our masks, we still wear our shields, we still do all our hand washing, but there's that extra feeling of protection that we're not, I don't strip when I come home anymore, that kind of thing, because I feel like I definitely have an extra protection there.
Yeah, and I think you also have seen a lot of people with COVID, right, Lise?
Yes, enough. The pregnant women with COVID are very, very sick.
I would put myself as one to get it as soon as I can. My wife is an ICU nurse, and so I definitely understand what Lisa is talking about in that sense of, coming home or like seeing her come, my wife come home at least. And she finally got vaccinated at the beginning of this year. And I work from home, so I don't have to go to the hospital or anything like that, but I'm very excited to get it when it's available.
I don't know. I am not in a hurry. Maybe down the road. I don't know. I really don't know. I'm just not in a hurry. If I had to, it would change if they're like, if you don't get the vaccine, then you can't fly. Then I would be like, oh shoot. And I would probably drag myself to go get it with hesitation. But I don't know. I'm not in a real hurry.
And why do you think you're not in a hurry, Sarita? And what's the word on the street? Like, you're telling me the word on the street? Can you share?
So honestly, I don't know. There's history of vaccines being used on the Black community, and so I think there's a little bit of that there. And the word on the street has been, for African American community, if you're going to take the vaccine, then you should probably make sure you take it in the white neighborhood. Go where the white folks are and then get their vaccination, because chances are that whatever they're giving them will be better quality than what they give African Americans. That may or may not be true. However, it's things like that sit in the back of my mind, and I'm always too I don't know. I just always feel sort of protected, which is why I don't get the flu vaccine and things like that, because of this is just me, because of my faith, and I always really feel protected. So then I'm always not in a hurry to run and get what everybody else does. Like, oh, we should all get this, and then run and get it. Although at the same time, I want people to be safe. I want to keep people safe, all that stuff. So I don't know. It's just a lot going on in here. Yeah. So yeah.
I get that. My kids are like that in terms of they're young, they're in their 20s, and they're invincible. Like they just say, I'm healthy. Like I have a good immune system. I'm not going to get this. And no matter if I say, young people get it, it's a total crapshoot. You don't know who's going to get it really bad. Like some people get it and they're asymptomatic. Some people get it and it's like a cold or the flu. Some people get it and they end up in the ICU, and some people and have long-term negative side effects. And so far, it's not just like the people you would expect who end up dying. So
yeah.
My personal relationship to it is I thought I would get it as soon as I could, and then somebody offered me, and she said, if I could get you on the list, would you get it? And I said yes. And so I have had the first vaccine, and I'm going to have my second one next week. And I didn't have any major side effects after the first one. Like I didn't have anaphylactic, obviously, which very few people do. And I didn't really have much pain. It wasn't any worse than any other kind of shot. It was better than tetanus, in terms of my arm, how my arm felt afterwards. But I was really tired the week afterwards. And I don't know whether that is related to the vaccine or not, because sometimes it's hard to tell if that's, a side effect connected to the vaccine or not. So let's see what the poll said. Andrew, I guess it went away for me, but can you tell us?
Here we go.
Okay, so 34% of the people on the call, or the people who answered, said they already have been woohoo. 17%, I want it as soon as I can get it. 34%, I'm not in a hurry, maybe down the road. And no thanks, not interested was 14%. So as soon as I can get it, or not, no thanks, not interested, we're about even. And so I'm not in a hurry, and I already have been. So that's really interesting for the group. And thank you for answering, and thank you for answering honestly, because that's, what we know is that's how people grow, is to be honest and get comfortable with exactly who they are and where they are. And then that, without pressure, there's the possibility of maybe of shifting. I'll tell you, after I got it, I'm just saying, after I got it, and this is part, Andrew, can we put up the next, after I got it, and I know I'm jumping to number 2 here, and I said I wouldn't do that, but it wasn't until after I got it that I read the paperwork where it said that there is no FDA approved vaccine. It's all emergency use authorization. And I was like, I had like a little bit of a step back. I was like, what's that? What? And then, so I guess I didn't think about it very much before I got it. I just was like, people need it. I need it. I'm going to get it. But Lisa, we have Lisa here to kind of lead us through with the knowledge about the different kinds of vaccines, what the difference is between them, what the difference is between emergency use authorization and FDA approved, and then some thoughts about effectiveness of this vaccine versus other vaccines, and then dangers and side effects.
Oh, okay, thank you. I'll answer to your FDA first. I will tell you, I didn't think twice about it, because my thought process is the COVID vaccine is like Russian roulette. You don't know which one's going to hit you and kill you. And so to me, I didn't know how my body would react. So I wanted to be protected. I knew that nobody had.
So you're not saying the vaccine is like Russian roulette. You're saying the disease is like Russian roulette.
The disease is. So for me, the disease is. So for me, the vaccine, nobody has died from it with any significant, when you look at all the statistics from all the 3 vaccines that are out there. So the FDA emergency use is basically saying they haven't finished completely the 3rd phase of trial, but the FDA said that it had gone through enough to make it be able to be applied in a positive way, to say that it had the 2 vaccines, the Pfizer and Moderna, had a 95 to 96% effectiveness rate from preventing COVID and serious effects. So the FDA gave all 3, Pfizer, Moderna, and J&J, emergency use authorization. It still needs to go through the last phase of the trial to be completely FDA approved. And I don't think anybody knows when that'll be done. Pfizer, Moderna, Pfizer was out first, Moderna followed in about 2 weeks later. They're very similar. I think the biggest difference between the 2 of them is how you store them. Pfizer needs these deep freezers, Moderna needs just a regular freezer, but they both are the RNA virus, the vaccine, which we'll talk about in a minute, but it's a newer way of making a vaccine, a newer way of getting your body to develop antibodies to this infection. And they did have the 96 to 98%, 97% effectiveness rate. Little difference in ages. I think Pfizer was 16 years of age and up. Moderna was 18 years of age and up. But overall, they're very similar in how they're given and how their effectiveness is. J&J is more of the traditional vaccine, which is using a little bit of the live virus, I believe, and putting that into your system so that you develop the antibodies that way. And that's the biggest difference between the 2. Messenger RNA versus using an attenuated virus that they put in another type of virus that they put in your body. So you're getting a real virus put into your body at small amounts and developing antibodies to it. That's the J&J.
And J&J is less effective, right?
J&J is a little less effective. It was about 60% effective towards moderate, 62% effective against moderate and severe diseases, but 88% effective against severe disease. So keeping you out of the hospital. So it was still doing its effect. I mean, if we go back, we were talking a little earlier, we go back about flu vaccines, not everybody gets them, but that can be anywhere between, we said 30 to, 25 to 35 to 40% effective when we get a flu vaccine. So, it is, but it still was very effective to protect us in the long run from severe hospitalizations.
And with Pfizer and Moderna, with the severe hospitalizations, it's like, if you get that vaccine, nobody died of COVID after they got that vaccine. It prevent 95% effective against severe, right? Against,
it was even against just getting COVID.
Okay. And okay, just getting COVID. And I know you said the flu vaccine was like it depends on the year and the strain of the flu, but it's between 30 and 60%.
I think so, somewhere in that range.
What about like MMR, or like how effective is that? Is that 100%, or is that also in the 90s?
I think as we looked that up, the MMR was about 88%. There's 3 different things in the MMR, but an average of about 88% effective against the 3 viruses after the second shot.
And that allows us to basically eliminate the disease from our population. Like that we don't. Okay, great.
So the MMR is your measles, mumps, rubella that the young kids get if they're opt for immunizations that they get at their younger ages.
Awesome. Okay, so we got Pfizer, Moderna. We're going to have an opportunity for other people to ask questions. If you have a question and you want to put it in the chat, you can do that, but we're going to have a time when you can ask questions. In terms of the effectiveness of the vaccine, we talked about that. What about, you know what you didn't talk about yet, Lisa, which is what this messenger RNA thing. Some people are saying like they don't want that version because there are 2 concerns. One concern is like this thing was put on the rush, Operation Warp Speed, and it's 1 year and they haven't had time to really test that technology, and it's new technology. So there's one concern about the new technology aspect, and there's another concern about like I don't want it to change my genes. So can you speak to those 2 things?
Well, I actually was speaking to Sarita, and she had a fantastic way of describing it. So I'm going to let her do that. But I just will say that they have been working on the messenger RNA delivering of vaccines for over 10 to 15 years in the development phase in the labs.
And with COVID, right? Moderna was working specifically with coronavirus.
That's
right?
The only reason we could have a vaccine within 9 months of when they needed to develop it. So people think it's been very rushed, but it actually has been being worked on in the labs. But Sarita, why don't you explain your description of that MSR, because I thought that was great.
Okay, so I got this from I think Tyler Perry did a special on the COVID-19 vaccine and the Black community, and he had a doctor on. And she explains it like this. She said DNA, everybody knows what DNA is. And DNA is like the blueprint of your house, right? Like your body, the blueprint of your body. And the mRNA is more like a contractor. So when you get the vaccine and they put the mRNA into your system, what it does is the contractor goes and says to the house, hey, this is how, look out for this danger. This is how you defeat it. I'm going to give you the instructions on how to beat this thing, and then I'm going to bounce. Meaning he's not going to stay there. So it doesn't stay in your system. He just goes down, the mRNA goes to the system and says, hey, this is what you need to be prepared. This is what you need to look out for. And then your body gets on alert. Like, oh, he's giving us the instructions. Now we're armed. Now we can, if this thing shows up, it's done for because we have what we need. And then the contractor leaves the building. So it literally like dissipates. So it doesn't stay in your system. It just gives the instructions and leaves. So that for me helped me because I was like, oh, okay, it's not gonna stay in my body. It's not gonna change my stuff. It's really just giving my body the instructions for how to beat this thing. If it shows up in my system like an intruder, then my body now has what it needs to take care of it. So that was helpful for me. I hope maybe that helps somebody else. It was very Tyler Perry said, give it to me like I'm a 5-year-old. And I was like, yes, I need that version. So I don't know.
As opposed to the traditional vaccines gave you a little bit of the actual virus for your body to develop an immunity to. So you had more chance of getting sick and holding on to that virus longer.
Yeah, thank you, Lisa, because that's what I was thinking too. And I was like, don't they give you the virus? Which is why I've never taken the flu vaccine, because I don't get sick. As I'm older, I get, I've gotten a couple of colds now and then, but I've never like had the flu where it was like taking me out, or I didn't have those issues. So I was like, why should I allow them to put something in my system that's going to make me sick even for a little bit? That just doesn't make sense to me. So that's what I was thinking, prior to hearing that conversation. And afterwards, I was like, oh, so they're not giving me the vaccine. They're not giving me the actual virus. They're just giving my body instructions on what to do to beat the virus. So that was very helpful for me.
Yeah, and for me, Sarita, also, like, I resonate with you. I don't get the flu shot either. And part of the reason I don't get the flu shot, I don't know if this is, I was thinking about getting the shingles one though, because I've had shingles and it's awful. So I was thinking like, I'm considering that shingles vaccine, but the flu shot, I just basically think I can keep myself, I'm going to like really work on keeping my immune system strong. I'm going to take supplements. I'm going to sleep enough. I'm going to eat good food. I'm going to exercise. And then anything that comes into my aura, I won't get.
Yeah.
So I understand that. But I didn't do that with COVID because, as Lisa says, it felt to me like I have had a lot of respiratory problems in my life. And at the beginning of COVID, especially, I was like, if I get this, I could very easily, my body, it's better to keep it healthy, because when it gets sick, all bets are off. Like it always becomes like the worst possible nightmare you could imagine. At least that's my experience with my body. So I was like, this is definitely something that I don't want to get, because I don't want to be in an ICU where they're deciding which of us can be intubated. I don't want to fight with people to stay. I don't want to, oh my gosh, I had so much anxiety about it, which is why I've been home for the last number of months, too. But so people said, Elda says she already had COVID-19 and retested and got a negative result on January 27. Searched for when I would be able to get the vaccine if it was available. I'd heard different things about how long to wait for vaccination after retesting negative for COVID-19. And so we will get to that, yes, Elda, and providing information on that issue. And I think what you're bringing up, Elda, is really smart, which is just because you've had COVID-19 once doesn't mean you can't get it again. Is that correct, Lisa? Like you can get it again, and you could get a different strain. And if it was okay the first time, like my mom, my dad had COVID right before he died, and my mother had COVID, tested positive for COVID, and was almost completely, our mother was almost completely asymptomatic. She didn't taste for a minute, but she was also completely asymptomatic. But she's getting vaccinated now, because who knows what happens the next time, right? Isn't that what we're at?
And again, you're not going to get herd immunity if we don't make sure that we keep our immunity in our system.
Thank you. So Lisa, I guess, do you know how soon after you retest negative for COVID, you can get the vaccine?
They tell you 3 months. And the idea is if you get it before 3 months, in the hospital, we've actually been giving it to people, healthcare workers before that 3 months, but the response of your body is actually more severe to the vaccine if you do it before that period of time. You have a bigger immune response and everything because you already have some COVID in your system, antibodies in your system, and you're getting a little bit more of a bigger response. So the manufacturers recommended 3 months after you've been diagnosed with COVID.
Thank you, Lisa. So what about the dangers and side effects of the vaccine itself? What do we know about the dangers or the side effects of the vaccine? Because
well, again, as you mentioned,
the reason I'm asking you this, Lisa, is because, when I got my vaccine, I asked the woman who put the needle in my arm, and then I asked the woman when I was checking out, if they'd had it, and both of them said no. And then I subsequently read that 40% of the people healthcare workers who were offered it, only 40% took it up. So I was like, what are they worried? What do they know that I don't know? Like, why are they not getting it? You know? So I was kind of like, so that's that. I didn't spend too much time trying to figure out what the dangers and side effects were because I already had it. But can you speak to that a little bit?
I can speak to what we know. And as you said earlier, it's really a matter of, as we've all said, turning in and accounting for what we feel so that they can get a better idea of what the side effects are. Definitely arm tenderness, headaches, fevers, chills, fatigue. Any of the symptoms that are the mild symptoms of COVID can be attributed with the vaccine. And a lot of times it comes 2 to 3 days after your vaccine. And after the second vaccine is supposedly when you're getting more of those symptoms. And that goes to what I just explained as to why you wait 3 months for your vaccine, right? And the first vaccine is giving you a smaller amount of the messenger RNA or whatever for your body to develop immunity. And then that 3 to 4 weeks later, you've got some more and your body already has those helpers in there and they're really coming up to fight it. So that's where you get a little bit more of that immune response. But there has been no deaths attributed to the vaccine. And when I looked at the Pfizer one, there was like a death of somebody who got the vaccine, but there's also 2 deaths of 2 people in the placebo group. So people do die, unfortunately, and it was not significant. So if you wanted to look through all that data, there is no significance of any, there was really no deaths associated with anybody that got COVID and having it be a COVID death.
Yeah, I read somebody in Virginia got the vaccine and died. And then it was when I looked it up, they died pretty soon after they got the vaccine, but it wasn't anaphylaxis. Like it wasn't like they were allergic to the vaccine. So it wasn't connected to the vaccine per se. But I don't know. I mean, as you say, like if two people in the placebo group died and a person in the actual vaccine group died, it's hard to know,
Right, but you also had more deaths on the other side, so you just have to look, whenever you look at studies, you have to look at whether it's statistically significant. So, but really the anaphylaxis is a very, very small amount of group. And I think it was a polyglycerol, which is something that they use in the messenger RNA, is the only thing that really is an allergy that you're not supposed to be getting it if they have that. It's not latex, it's not eggs, it's not any of those things that the other older vaccines were. Or if you have a reaction to the first one that's really bad, you obviously aren't going to get your second vaccine. But the dangers and side effects, I think the biggest thing, as Sarita had mentioned, is we don't know. We don't know what the lasting and what other side effects can come from it, but we also don't know what the lasting effects of COVID is on our body. So, really it's that crapshoot of which one do you want to play with, so.
Awesome.
I don't want to play with either of them.
You're out of luck on that one, Sarita.
Well,
I know.
It's in the gym with us.
Well, I just think that some of those people that have very severe COVID, like long-term effects on heart, lungs, like your digestive system, like
neurological.
What?
Neurological.
Yeah. So there's some really scary stuff out there with, I think also people were saying that if they're planning to so say the allergy thing again, Lisa, like if they're allergic to what, they shouldn't get it?
It was, I wrote it down. It was a PEG, it's called. It's what they use to make the messenger RNA. And I looked and I didn't see that it was in anything else that we traditionally use. You know what I mean? So there'd be no way of knowing if you were going to be allergic to it, except for if you had a bad response with your first immunization, a really bad response.
Okay. All right. But the other ones, the more traditional ones, or the older vaccines, there were eggs and latex and those kinds of things. And like
Guillain-Barré was something that you weren't supposed to get it for a flu shot and things like that. And they are no longer, they are not in this COVID vaccine on the Moderna and the Pfizer.
Okay, let's move to the next slide because we're starting to get questions in the chat and this is awesome. And our next slide is all about questions. So we have a question from Alma is, has there been a reaction for people ages 80 and up?
I don't know that they differentiated it by age.
Yeah, I haven't seen anything either. Sarita, did you see anything?
No.
Okay, so Tracy says, and this is a personal question, but my question is, do you personally feel that teachers should have both doses before returning to work? So I think that's also a question, Lisa, about, I felt like I read something that said I had some more immunity than I had before after getting the first vaccine. And then it was like up to the 95% after the second one. But what's the difference between in that time period about your, immunity? Do you know?
If you're asking for the perspective of one vaccine versus two,
Yeah.
yes, after 7 days after getting your first vaccine, you do have some immunity to it, which will be lasting for a shorter period of time than it will when you get that second vaccine. And I don't think we really know for how long, but we do feel like you have a better immunity towards it. I just want to put on the back of that, from what you said when you talk about teachers, we're talking about the elementary and younger children. They have not been seen to be a vector to spreading the COVID-19 virus. And they have had minimal, if any, distribution of that virus from them bringing it into school. And they also think, and this is what I read, and I think they're still looking into it, whether they feel the MMR vaccine and the level of immunity to that in those children is actually a protectant for those children. So that's just out there. That's just something being.
I don't understand. Can you say that again?
Obviously, children, school-age children have had the measles, mumps, rubella vaccine sooner than you and I, right? Yeah. We have that immunity in our system for a larger amount because they've just gotten vaccinated, right? In their younger years. And they're looking at an association between have that immunity in your system and protectant against getting COVID.
Oh, interesting.
Wow. It's still being discussed and looked into, but that was something. So I don't really feel that at least the younger children and the younger teachers that deal with the younger children, if you're having your masks and things like that, personal opinion, I don't think that they're at a big risk, the teachers. I have a granddaughter that's been in since September, full day, 5 days a week. They've had no shutdowns. They've had no transference of COVID in that classroom. They've had a couple COVID cases in the school, and that came from home. So,
So, and Renee says, but can the youth spread COVID? Like could they be carriers and take it home to grandma?
It depends on what youth you're talking about. Are you talking about elementary? Are you talking about middle school? Are you talking about high school? I think the age makes a difference.
That's the second question about the vaccine in a way, Lisa, which is like, one thing is, okay, so I can't get it. Like if I get the vaccine, I won't get it. But then there's the other question is, but it won't make me sick. But if I'm around, like, say I'm around a lot of people who have COVID, can it kind of be on me such that when I cough on someone, they could actually get it? Can I be a carrier of it if I've been vaccinated?
I don't think any of us can answer that 100%, but what I will tell you from what they're looking at, and when they're kind of like putting this into a perspective of other vaccines that people got, and when they got polio and when they got measles, mumps, rubella and stuff like that, they did not seem to be carriers and giving it to other people. So I think from that perspective, they're thinking that no, you're not going to be able to transfer enough of that virus to somebody else for them to get sick. But I don't think we have that answer enough. And that's why we're still told to wear our masks and protect and all that stuff, even if we're vaccinated.
Well, and the kids who aren't vaccinated but just might have more natural immunity because of other vaccinations they've had, I think it's also unknown, right? Like it's unknown if they could carry.
And remember, our studies right now have only been done from 16 to 18 years of age and up.
So no studies on.
I know. Just listen. I was just gonna say, Lisa, listening to you, and you shared a lot of good information, and at the same time, I've heard so much uncertainty, like, we're not sure, they're not sure. And I think that's why recently my husband got the vaccine and we had talked about it briefly. Like, what do you think about the vaccine? I don't know. What do you think? And then we sort of left it there and didn't talk about it anymore. And then Monday he came home. I get this text and he's like, hey, I'm getting the vaccine today. What? And then by the time I picked up the phone to call him, he's like whispering. I'm like, what are you doing? He's like, I'm getting the vaccine. What? And I was so taken aback. I just didn't know I was really emotional. I had tears and I was like crying. I got, I'm like, what do you mean? And he's like, what? What's the big deal? And I'm at home just like with tears pouring down my face because and then I was like, I need to process this with somebody. Like, why is this affecting me like this? Like, I don't even know. And I think it's because all the uncertainty. Like, you just got a vaccine. Like, I feel like this is different from a flu vaccine. Like, this is major. We don't know anything about this vaccine. What happens if you grow an extra arm, or, you know, further down the line? Like, I got to be the person to take care of you. I'm horrible at that. So, you know, I'm just like, I had so much stuff in my brain about this thing. And then my concern too is, so you get the vaccine now, and then there's a new strand of COVID coming. Does the vaccine protect against that new strand?
Well,
And
that's
there's
the question,
probably no
Sarita.
uncertainty to that too either.
No, there is some research on that, Sarita. So let's talk about that for a second, which is
Okay.
how effective are the Pfizer and Moderna vaccines against new strains of COVID? Lisa, have you?
Yeah.
I mean, obviously they're still studying it, but they're saying that the Pfizer, Moderna are still protected against the Brazilian strain. I think they don't have enough literature and information to say about the South African one.
Okay, is the vaccine safe for pregnant women? Joanna asks.
I will tell you, I work in labor and delivery and outpatient OBGYN, and I'll tell you what our maternal fetal medicine group, which is the high-risk baby doctors, say is it's really up to the mother. They do not feel that there's anything with the way that the vaccine is being developed, or how your body reacts to it in your body, that would have any negative effect against the baby. We do not say get it. We do not say don't get it. We say whatever makes you feel comfortable.
Okay. But you also say that there's no evidence that it's bad for the. Okay.
Correct. That's really, and I will tell you that the personal healthcare workers that I work with that are pregnant have gotten it.
Okay. And we're hearing, like Tammy says, I think this is, you know, Sarita, this is also important for you. I know it came at a different time in the conversation, but Tammy's saying she was hospitalized with pneumonia last January and they weren't testing for COVID yet. But looking back, it may well have been COVID that she was sick with, and her lungs have not been the same since. Asthma has been so much harder to control. So I think you have to think about, like, you're concerned that he's going to grow an extra arm. Like, how many, like, no, I'm saying, like, that you said that in jest, but at the same time, our fears can get like really out of control about like really negative things that are unlikely to happen. And then you also have to weigh that against what would happen if you got COVID. You know, like what would taking care of him after a severe bout with COVID look like, or you know, so I think we all have to weigh those things. Ruth thinks that teachers should be obligated to take both shots, just like health professionals. And then Renee's asking, can elementary age youth right now spread COVID?
I don't think we have enough studies to say it. All I can tell you is that the majority of there are not a lot of majority of cases in those schools where the youth are in school. They have not had major outbreaks. They have not had, you know, spreading between a lot of kids in the class, you know, so I think that we have to, you know, kind of wait.
When they go home, you know, do they have outbreaks in their families? I guess that's the question.
Well, how do we know how they got it in their family? They're not the ones that are bringing it home to spread it. I think that you have to assume that somebody in the family, that would be my assumption, is coming in contact with it if a child gets it. Youth do have a less of a chance of being positive. We've seen that already.
Awesome.
I feel like too, like everybody has to be, the kids have to be vaccinated before they can go to school. You know, like the beginning of the year, they have to be vaccinated. So I agree with whoever just said, like, should the teachers, you know, the teachers should be obligated to get it, both shots, before going to the school, because the kids have to be vaccinated. Like, they have a fit if you try and send kids to school without vaccinations.
We're not going to get obligation to get it until it's FDA approved. Nobody in the healthcare is obligated to get it yet either, because it's not FDA approved. So I think until the FDA approval comes through, nobody can be mandated.
Yeah.
But I agree.
Good, because I don't be mandated.
I see this.
There's a question, one question, Gwendolyn, that asked, I've heard the vaccine is only good for 90 days. Is this true? Will a booster be needed every 3 months?
No, 90 days is not, we do not think we think it's good, better for more than 90 days, but I don't think we know whether we're going to need boosters yearly.
So we don't, so right now, what are they saying? How long are they saying it's going to be good for?
Well, I guess, excuse me for a second. Um,
Mom, it's mom in
the,
the background.
how long has it been since we started giving it to our people that trialed it? You know, that's the question. So far now, they still have immunity.
Okay.
So I'd have to go back and see, was it a couple months before when we, you know, was it been 6 months now? I think we don't know. I mean, the bottom line is we have no answers until we follow those people that were in the first vaccine trials and keep watching their immunity.
Okay. Yesenia asks, can a 19-year-old get vaccinated?
Yes. By Pfizer and Moderna, both of them, Pfizer, Moderna, and I believe J&J. Yeah, it's 18 years old for Moderna and J&J and 16 for Pfizer.
Okay, awesome. So any other questions before we go to the next slide? Lisa, this has been really helpful. Do people who get the vaccine still need to wear protective gear and take precautions?
Absolutely.
Yes, and why?
Because again, we are just told we don't know everything about it. So we are just being extra cautious and wearing all of our PPE the same way as we did prior, because we do not have herd immunity yet. And we don't know whether it's effective against other strains, and they just aren't willing to say yet to put your guard down.
Okay.
Can I ask how much longer, I'm sorry, go ahead, Katthe.
One more question was, does the vaccine work the same as the flu vaccine? But Lisa already said that it's much more effective than the flu vaccine, but is the flu vaccine a messenger RNA vaccine, or is it it's the old fashioned kind where
it's the old fashioned? They're looking to change a lot of the vaccines into the mRNA to see, because I think they think it's more effective.
Okay, cool.
I was just gonna say, how much longer does that first trial people have to go through?
Oh, they're gonna follow them for 2 years.
For 2 years.
They're following them for 2 years. Yeah.
For 2 years. So that's how long we'll know before it's good to go, or like it's effective and get all the answers to what we need.
I personally feel we have that, Sarita. No, I'm kidding. But I think that every month that goes by and we get more information, but it's just a matter of, this is the way it is with trials. I mean, you have to watch and see what happens and watch and see what our immunity stays with.
So one more question from Yesenia. What if you're allergic to PCN? Can we still take the vaccine? What's
penicillin.
Oh, okay.
Yes, there's no contraindication to any drug allergies of any kind.
Awesome. Okay, well, we are going to launch the poll once again about how you feel about the vaccine, just to see if if anybody changed their mind. Not that you have to, but I just was interested in seeing if people are in the same place as they were at the beginning, or if anybody moved either way. So let's go to the next slide while people are filling that out. And their last question is, what can you do, or are you doing, to assist with ending COVID? And I think that this is not the obvious ones. I'm going to throw it out there. The obvious ones are the vaccine and masks, right? And you can see Andrew with his wife here, who is the ICU nurse. But what else can you do, or are you doing, to assist with ending COVID? Lisa, Sarita?
Oh, I mean, I think just limiting your circles. Who you're with, who you put your guard down with, staying, if you do have an immediate circle that you're with, then those people have to be your only people that you're with without a mask.
So wearing the mask, I think for me, it is like limiting my exposure, because if I got sick, or if I was carrying it, like who knows who I could give it to, and just staying out of places. I think also, this is a little bit indirect, but I think everything we do to keep ourselves healthy, everything we do to prevent disease for ourselves, like taking vitamin D, for example, or making sure that I get enough sleep, or eating healthy food, like reducing my stress, having some kind of like spiritual practice that reduces my stress. I feel like not like keeping myself healthy helps to keep other people healthy. That's one thing I've learned.
I agree. I agree with you, Katthe. I agree with both of you guys, because I agree with you, like holistically taking care of myself, in a holistic way that can help everybody and limiting my exposure.
So Rebecca
Although
says,
I'm ready to get out the house.
yeah, Rebecca's trying to keep shopping trips short and avoiding crowds. Tammy says, I stay home. We have everything delivered. Elda says, using PPE as recommended, social distancing, washing our hands frequently, limiting social interactions with people we don't shelter with, keeping ourselves healthy and active. Wow. Elda, you could do a workshop. Renee says, not traveling far.
And you had mentioned, Katthe, vitamin D and zinc. Absolutely. Vitamin D, at least 400 international units, and zinc is 25 milligrams a day.
So vitamin D is 400 international units. And what's zinc?
25 milligrams.
And I know I've told you all this, but getting out in the sun as often as possible helps. Also, multivitamin with added D, Gwendolyn says. The vitamin D, I thought the research on that was like people who had died of COVID, when they tested their vitamin D levels, they were very low, or a large proportion of them were. Is that accurate? And so that's why they don't know that vitamin D protects against COVID, but they know that people that die of COVID have low vitamin D. Is that?
What I will tell you is that about 80% of the women I test, because I test that at every annual exam that I do with my women, have been deficient and severely deficient. So if you go to your regular visits, whether it's your primary or your GYN, request to at least get a baseline vitamin D done, because you probably are going to be in the deficient range if you don't take supplements. And vitamin D is sensitive. It is increasing your risk of cancers, autoimmune diseases, osteoporosis.
Like if you a deficiency in vitamin D is related to those big things.
Correct.
Okay. Well, that's
Thanks so much for saying that, because somebody told me to get vitamin D and zinc, and I didn't know what. I just bought some, and then I was like, I haven't taken it because I was like, well, I don't even know how much of this is good to take. So thank you for that.
Your 400 is your
definitely
base level. Your 400 is your base level. 1,000 is what I take.
I'm taking what you take.
Okay.
Well, that's, and I'm going to tell everybody, I got at the beginning of COVID, I got gummies because I don't like taking pills, and I've been very hard. I know I should take a multivitamin, etc. But when I got the gummies, they have vitamin D gummies, like with K3, and they also have elderberry with zinc gummies, and like they taste good. So it's like a spoonful of sugar helps the medicine go down. So Tammy said her daughter's doctor had her taking 10,000 a week at one point.
That's what you do with severe deficiency.
And Alma said, I don't allow my siblings to come visit my dad, who's 85. They do ask if they wear a mask. Is that fine? But the concern is not only my dad, but my family. So
yeah, the mask is not going to protect completely.
Yeah. So this has been, can you just say that one thing about, my understanding about the mask, I just want to check it with you, Lisa, but we wear a mask like one of these masks, which is not a N95 or KN95. We wear this so that our germs don't get out to other people, right? Like it doesn't necessarily, is that right?
That's right. It also does protect us from other people coughing on us as well. It's a protectant for both.
Well, so what's the difference between having like the kind of PPE that you have, the plastic shield and the N95 and this kind of mask?
Well, the N95 is kind of like no breathing. Everything is inside. There is absolutely nothing able to get in the sides. It's very tight against your face. The shield protects your mucous membranes of your eyes. So just regular glasses with them being open here does not do enough protection. So, anything we wear is going to be protectant. But I think as we discussed earlier, Katthe, people who say masks aren't effective, why do we wear them in hospitals and in surgeries? It protects from infection.
Right. So like that's what I was saying to my cousin who was saying that, masks don't protect. And I was like, okay, so next time you have surgery, you want your doctor not to wear a mask? You want him to be coughing into your open wound? Would that be a good thing? Right. Is plastic shield helpful? How about for people who can't wear traditional masks?
It's definitely helpful, but it's not going to be as good as putting a mask on because it's from a farther distance. I guess it would help, but you still have all this area underneath where germs can get in.
All right. Well, thank you so much, Lisa. Andrew, can you give the poll results? See where we are?
looks like we had less people vote this time.
Ah, okay. But we still have percentages. It's interesting.
More people are not interested.
More people are not interested as a result of this. More percentages are not interested. Awesome. Okay, well, thank you very much, everybody, for participating. Thank you, Lisa, for coming. Thank you for being open and vulnerable and sharing, everybody, where you are with this and for all your questions. We hope this was valuable. And we encourage you to get as much information as you can and talk to your doctor and really get as informed as you can and get the advice, that you need for you from the people that you trust. So I just want to, again, thank you, Lisa. Next Tuesday, Alexandra and I will be here. We're going to have a Black History Month celebration, talking about family and community sustainability. And then Lori Myron Manbeck will be here on Wednesday about aging elders in the pandemic. Terry Gibbs is going to be back for our month on sustainability, talking about natural step to sustainability, health, and saving money in the planet. And then Tunja's back on Friday with supporting math skills at home. So we look forward to you joining us at one of our upcoming webinars. And we're really grateful that you were here today.
Thanks, guys.
Thanks, guys. Enjoyed you.
And what do you want to amplify coming out of this? What do you think we need to share on coming out of this? Amplify safety, Tracy says. What do we want to amplify? What do you want to amplify, Sarita?
Amplify hope.
Amplify hope. Elda says amplify health. Amplify, Gwendolyn says amplify information. Amplify hospitals. Amplify get vaccinated. Vaccinations. Let's go to the next one. Herd immunity. Amplify herd immunity. Get into herd immunity. Amplify COVID ends.
Yes.
And then finally, if you or one of your colleagues would like to host a webinar with us, contact me at bestrongfamilies.net and we'll have a conversation and figure it out. So thank you, everybody, for being here and look forward to seeing you next time. And thank you, Sarita. Thank you, Andrew. Thank you, Lisa.
Thanks,
Jeff,
Kath.
Thank you, Katthe.